Hey everybody, it's End Times Talk. Good to see you. I have a lot of information to go over, so I'm just going to hop right to it here. I'm going to start with America because I live in America. The Daily Mail just released this today. All right, now I want to go through a lot of stuff here today to try to show you what I think and what I believe is happening. All right, but I'm going to just go ahead and read this article here. A deadly quademic is taking shape in the United States as the months get colder and people gather indoors. That's very indicative of the SPARS pandemic 2025 to 2028, which we'll go into. Threatening to overwhelm hospitals, disrupt children's education, and pose a deadly risk to vulnerable seniors. Winter surges of COVID, and I want to say this before I go on. I'm of the school of thought that this doesn't have to be an actual virus. It can be like, towers, frequencies. Okay. Just I'm putting that out there. Okay. All right. Um, that it could disrupt children's education and pose a deadly risk to vulnerable seniors, winter surges of COVID, respiratory syncytial, I'm sorry, that's terrible, virus, which is RSV, norovirus, commonly called the stomach flu, and influenza have become regular occurrences since the pandemic has waned. But this year, the U.S. is contending with a dangerous super flu. And I think this is that China flu. You know what I'm saying, that I've been telling you about, that I told you about a little bit ago, and I just had a feeling it wouldn't be long till it reached the U.S. Cases of influenza, and I was just waiting because I've been busy with other stuff too, so I'm like juggling a lot of different topics here lately. Cases of influenza are climbing in more than 3 dozen states. All right, that's 36 states, more than 3 dozen. So that's more than 36 states where influenza cases are climbing. They're on track to overshadow last year's particularly severe flu season, during which there were uh, five 560,000 hospitalizations and approximately 38,000 deaths between September last year and August. The new influenza strain H3N2 subclade K is ripping through the United Kingdom, and we'll get into that in a moment. Especially among seniors and people with compromised immune systems, this dominant strain does not match this year's flu shot and has shown signs of causing more severe illness. Um, and remember, we've been talking about on this channel for some time, how they're past 5G, they're into 6G, and they're into 7G. Actually, a lot of people don't know and aren't aware how far and about. I have lives where I've proven this, where they're literally telling us it's just not available to the public. Okay, the CDC has reported that between 1.9 million and 3.3 million Americans have had the flu since October 1st, and 19,000 to 38,000 have been hospitalized. The surge has led to a reinstatement of mask mandates across several states for everyone entering a hospital. So when you are on on property of medical facility, okay, they're reinstating the mask mandates. They're bringing it back. And remember, this is what they did before. They spoon fed us the mask mandates. Okay. And we all know the science behind all of that, mumbo jumbo. Several states have been hit particularly hard. Flu activity in Massachusetts is accelerating sharply, signaling an early and potentially deadly season in just over 2 weeks. Hospitalizations linked to flu more than doubled, reaching point 0.4 of all admissions by mid November. The surge has been reflected in lab data, with confirmed cases jumping from 251 to 450 in a single week. And in Iowa, the Moulton Udall School District took the drastic step of canceling classes for 2 days due to an extremely high percentage of illness among students and staff. The district has also called off athletic events. Doesn't that sound familiar? Nearly 30% of students and staff are sick, and I do know people in education, and I'm going to be getting a hold of them. All right. Iowa statewide burden of flu and COVID has been deemed low by the Iowa Department of Health and Human Services. Those signs point to an imminent increase in case rates as the season progresses. And we're just in the beginning of season. And I'm going to tell you something, and I'm going to go down that conspiracy rabbit hole. Does anybody remember how weird it smelled outside lately? I mean, I don't know if you have been outside and you have been, you know, uh, smelling this weird smell. If you live in the colder states, especially, like I've been smelling it myself. And then there's this huge chemical fog that's in California. All right. I don't know if y'all are aware of that, but I mean, this thing stretches like 400 miles long, they're saying. And it's basically almost the whole state of California where this fog is at. And I'm telling you, this isn't good. It does, they definitely could be spraying. They definitely could be doing this and that. It could be towers with frequencies. It could be a million things. But regardless of the approach and how they're implementing it, it seems that something is emerging. And there has been. And let me see here. I forget the channel, but there is a channel that is a whistleblower against China, and they were talking about how there's a flu in China that literally is causing people to drop dead within a 24-hour period, and that the hospitals and the crematoriums and the morgues are overran. Um, that's weird. Is everybody seeing buffering? Is it just my wife, Mrs. End Times Talk, or are you guys experiencing uh, buffering while I'm doing this? Just if you could throw this in the live chat. Oh, it did for a second. Okay, I'll continue on then. Um, you see how they silence me, man. You get over the target and they just want to shut you down. I like earlier, I had my whole entire documentary project deleted. I was able to put it back together piece by piece by piece, but it took me an hour and a half to do so. Um, Anyways, so the rate of lab confirmed flu tests in the state has been creeping up, mirroring the same track as last year's gradual, then abrupt rise. About 3.5% of COVID PCR tests collected in Iowa came back positive in the second to last week of November, is a 0.5% increase from the previous week. At the same time, Central Iowa, and I mean, I could go on and on, but I think you guys get the gist. I don't want to just ramble on about this. You guys can go read it if you need to. It is Daily Mail. Deadly superflu surge forces schools to close and triggers mask mandates across the U.S. And these are the hospitals. These are the hospitals. Right here, this says, I'm a virus hunter. H3N2 is unlike any strain of flu I've ever seen. We'll click that and see what pops up here. Let me make sure that y'all are seeing it. Okay. Britain is being battered by a record breaking surge in flu, largely driven by the mutant H3N2 strain. The number of hospital beds occupied by infected patients is already higher than ever for this time of year, with no peak in sight, officials have warned. Mandatory mask rules have been established in certain hospitals in England amid rising infection numbers. Globally, people in Japan and parts of the US and Spain have already been urged to mask up. Does this sound familiar, everybody? Does this sound familiar? Okay. I think it's pretty clear what's going on. And I'll show one more thing here. I'm not going to read these articles. You can go look them up yourself. But I'll share one more with you. It's just, and this was today. There you go. They're telling you. Superflu spreads across Europe. UK hospitals declare critical incidents and schools shut. Cases surge in France, and demand for face mask and medicine skyrockets in Spain. I'm going to go through this. Based on available information as of December 10th, 2025, there are several notable pandemic-related simulations, exercises, or war games, often tabletop or scenario-based drills that have been conducted or referenced this year. These are typical designed to test preparedness for infectious disease outbreaks, drawing from lessons of past events like COVID-19, including details on scenarios, participants, and outcomes were known. No simulations directly involves. Well, wait, no, hold on one second. I'm trying to cut through the cheese here and get to the meat and potatoes. Uh, the largest UK pandemic simulation in nearly a decade, classified as a tier 1 national exercise. It's called Exercise Pegasus, and it ran in the UK from September to November 2025. It simulated an outbreak of enterovirus EVD68, a respiratory virus thought to originate from pigs in Southeast Asia. And it's interesting that this Asia flu has been happening, primarily affecting and killing children. The drill tested government response across departments. Now, I'm going to say this, and this just pops to my mind. My brother Clayton Joseph down in Brazil, he helps translate, different videos for me when they pop up down in Brazil. And there was a woman that had been given a prophetic dream by the Lord. And I do believe that it was prophetic in nature. I do. I very rarely bite on to prophetic dreams because, everybody wants to be a star nowadays and have their 5 minutes of fame. And some people will just come out with something, speak some mumbo jumbo, and act like they know what they're talking about. But this woman had said that there was a virus that was coming in the coming years, and this was a few years ago, a couple of years ago. She said in the coming years, and she said that women would be taking their babies that were sick and putting them out in the street because the parents didn't want to get sick. So when they said primarily affecting children in Exercise Pegasus, that concerned me, and I wanted to bring up that prophetic dream that woman had stated. And she said that this virus would ravage and would be really bad and would lead to pandemic lockdowns across the world. Says here in Exercise Pegasus, the drill tested government response across departments, including COBR, cabinet office briefing rooms, COBR activation, supply chain disruptions, travel restrictions, business closures, and countering misinformation. I mean, there's your censorship. There's your lockdown, travel restrictions, and business closures. And then in doing so, supply chain disruptions. I mean, they saw what they did from the first pandemic, and they are working towards doing that again. Now, key elements involved all major government departments, e.g. the DHSC, the UKHSA, and the DFE, and ministers and international coordination. A controversial aspect was unannounced, no notice lockdowns in about 20 English schools. So they scared the crap out of the kids and locked them down, just boom, lockdown. And probably the parents couldn't get their kids. But a controversial aspect was unannounced, no notice lockdowns in about 20 English schools in the UK, where students were instructed to hide under desks. Lights were turned off and classrooms were barricaded, simulating a biohazard response. Head teachers were sworn to secrecy initially, and parents were not informed in advance. This was described as building muscle memory for emergencies, but raised concerns about traumatizing the children. And the status of it concluded last month for first of its kind since Exercise Cygnus in 2016, which was another flu simulation. So this is Exercise Pegasus that just happened in the UK. There's also Operation Outbreak in the US, and there's ongoing simulations right now for Operation Outbreak, a hands-on pandemic simulation game run across US schools and community. Does this all sound familiar? I mean, do you guys see the parallels here? Is what that's what I'm trying to get at. I want people to see the parallels here between the simulations and the tabletop exercises and the war games that they're doing, and what's actually happening and what they're saying in the news, what I just showed you. Where participants, often students, role play responding to a hypothetical outbreak. It emphasizes decision making under uncertainty, including containment, communication, and resource allocation. Results have shown gaps in preparedness with unsettling outcomes in many runs. Developed by organizations like the Sabeti Lab, SABETI, Sabeti Lab, focuses on real-time scenarios to build intuition for threats like novel viruses. And it's still active at this time, with sessions reported nationwide. Now, I'm just going to go ahead and show you this one because this is what's next on the list, and I think it's important that we discuss it because I think this is the real shebang here, okay? And it has been the real shebang, okay? Um, and in this, if we go through it, it starts off with a group of Baptist Christians. Of course, Christians are to blame. They go over to Asia for missionary work and come back bringing back St. Paul acute respiratory syndrome. And in this, if you kind of go through this with a fine tooth comb here, you'll find out that uh, they know that things are going to spread during the Black Friday Thanksgiving timeframe, which I think is exactly what you know it's going on right now. It's exactly what just kind of happened. We just had Black Friday and Thanksgiving, and then now this is what's going on. Now they're talking about school closures and mask mandates on medical facilities across the nation, probably also in nursing homes. But later on in the wargaming scenario, you find out, like, for right here, let me make sure. Yeah. So they basically go on to say, like, oh, we all the preventative measures that were disseminated annually for the seasonal influenza combined with isolation procedures for suspected cases would be effective at combating the spread of spars. And so they knew it was coming and did nothing about it. They just figure, oh well, it's flu season already, people should figure it out, and they sat back and they watched this thing take note. Okay. And it's interesting because later on in the war game scenario, that's by John Hopkins, the same people that brought you COVID-19 in Event 201. Okay. They go on to say that basically during the Christmas season and New Year's season, it's going to get really bad. And look where we're at now. You see what I'm saying? So, and then the rest of the document has to deal with, them coming up with a cure and there being side effects, right? And then them countering the people standing against online what it all is and saying, like, oh, this stuff's bad for you, don't do this. And they're starting to, uh, they're starting to put forward countermeasures. And that's your they got your lockdown, then they got your censorship. And I told you that censorship is coming. And so they say that this is 2025 to 2028, and it lines up with, them telling us now all across the board that a super flu is not just in the UK, but also in America. And in America, they're closing down schools. Hold on one second. Let me do this here, and I'll show you one more moment. Because for new people hopping on, I want them to see what we're talking about here. And so again, this was today, just released today. Deadly superflu surge forces schools to close and triggers mask mandates across the U.S. But it goes on to say on medical facility property. All right, but that's how they spoon fed it to us before. It is what it is. Anyways, let me keep going here. The 2025 pandemic game simulation competition, an immersive student competition simulating high stakes policy decisions during a crisis, including outbreak management and ethical dilemmas. Hosted by DMS Academy, participants navigate evolving scenarios similar to real pandemics. And they're saying it ran in 2025 as an educational tool. So there's also other notable 2025 related simulations like the Gaming Emergency Response to Disease course in the US that's ongoing, a course by MORS covering national international pandemic games, including novel organisms and bioterrorism scenarios. And remember, there are people that want to do this to us. Like, this isn't just like this, you can buy viruses on the dark web now relatively easy. They've come out and told us this. The Rand Corporation's Wargaming for Societal Resilience, global resilience. And they did this in April 2025, and it explored the strategies for resilience against pandemics and other threats through wargaming. They also have another one called Ready, Set, Respond, a game by NYAS where players handle evolving public health crisis used in training. And then there's also the Urban Outbreak Online Simulation in the US, Naval War College MIT tool for civilian military responses, updated discussions in 2025. So, I mean, there is a lot of simulations they've been running right now for this time period. Then, hold on one second. And I've shown you this before that last year in October, they did this bird flu summit, and it doesn't have to be the bird flu. It's a flu, H3N2, and they're saying they've never seen anything like it. Now, I will say this, okay? I will say this. But here's the thing. I'm gonna have to turn off the live chat because it's distracting for me. Anyways, so what was I gonna say? Crap. Give me a moment here because it was important. Well, anyways, I'm just gonna go through and say this, that if you go into this, at the head of it is mass fatality management planning. And like I said, whether it's bird flu, whether it's something else, whether it's a frequency, whether it's stuff that's been sprayed, there's obviously something going on. Okay. All right. And there will be people that argue out there that, viruses aren't, a thing. And, very possibly, I don't know. I'm not a scientist. I'm not a doctor or anything like that. So I can't say. But what I will say is that they're planning for something where there is mass fatality. Okay. And they have been since October of last year. And, they go through and are preparing, lockdowns and, we're seeing it from multiple angles. Give me a moment here. This one right here was the war game scenario. It's taken for forever to load. I don't know if you guys can see it or not, but this was the war games. Okay, this was the war game scenario for the COVID-19 pandemic, and it was ran just before it happened. And so what I'm trying to show everybody is that they're running these war game scenarios right now, and I gave you a list. All right, and the thing is, um, you know, and share, you got to be careful what you say, sister, because YouTube is very sensitive about these topics, and I don't want to get taken down. I'm trying to bring people information, not get taken down right now. Um, so, anyways, and I can get in trouble for comments, so and not taking care of them. Anyways, I had brought this up last year because I thought it would be 2024 of the fall to 2025 to 2028. You see what I'm saying? I understand, Cher. You're good. But so the thing is that it wasn't, and I read through it with a fine tooth comb, and it was more along the lines of fall 2025 to 2028. And again, like I've shown you, this right here was the war game scenario for the COVID-19 pandemic. And I mean, if you look at the bottom, it's John Hopkins. Look at the lower left corner there, John Hopkins. And right here, it's John Hopkins. The same people that brought you Event 201 that led to the COVID-19 pandemic, again, are bringing you SPARS pandemic. And then the emphasis is that it's Christians that were the problem, that wouldn't take the jabby, okay? They actually were resistant to that, come back to America after visiting Asia and brought in the St. Paul acute respiratory syndrome. And so again, like I was saying, they say that it would spread during Black Friday, Thanksgiving nationally, which is what it's doing. And then later on, they go through and they talk about, I'll just try to read it here. Early in the SPARS pandemic, public health and medical professionals were hopeful that the outbreak could be contained through case identification and isolation. It quickly became clear, however, that the strategy was not as effective as initially hoped. First, challenges in identifying mild cases limited the impact of isolation programs because the initiated symptoms of SPARS closely resembled influenza. Many who contracted SPARS did not immediately seek care. And I mean, like nowadays, even myself, like yeah, no, I agree, Frankie. I agree, Frankie. Absolutely, exactly. And the thing is that you know I keep forgetting. I hold on. I'm gonna not look at the live chat right now. I got to stay away from that because it distracts me. I'm autistic, so I have a one track mind on stuff like this. So, um, because the initial symptoms of SPARS closely resembled influenza, many who contracted SPARS did not immediately seek care. And like I myself, I'm gonna go about things. You know, hold on. Let me organize something here. Let me hold on 1 second. I'm trying to give you guys a hint here. You know what I mean? And let me put this over here. Okay. Hold on. I'm gonna do that again. All right. And I think people are getting the picture. You know what I'm saying? I'm gonna put this over here. All right. Just moving some stuff around on my shelves here. Okay. You know, even these sort of things help. You know what I mean? And hold on, this one's really heavy. Hold on. Okay, you guys get what I'm saying? All right, and there's a trifecta that you can do that can help you. And I got to be real careful here. Hold on, let me move this. Okay, over here too. Those things, you can make some decisions and take a stand. I'm trying to give you hints here, and I hope people are catching what I'm saying. And so I'm the same way. I'm not going to just run to a tyrant hospital. Okay, I'm not gonna. Yeah, absolutely got to clean the office, Mrs. End Times Talk. And so, like the thing is that I don't trust the system. All of them are liberals and communists, ungodly commies in the medical system now because during the first pandemic, because they forced this, they ousted everybody that actually cared. And I mean, there's people in there that like to murder people. All right. And I'm being honest with you. Like, there's people that legally murder people and get away with it in that. Okay. So I hope you guys caught what, as I was cleaning my office, what I was cleaning. And if you go back, and pause it or whatever, and I would go out, I'm a person, I can't swallow the things in capsules. So I go with gummies, because otherwise I choke. So, anyways, yeah, so they war gamed this, and it happened right before it happened, and they're wargaming this, and hold on, I'm trying to get this up here. So, anyways, assuming they merely had the flu, fortunately, some who thought they had the flu chose to isolate themselves at home, thereby preventing the spread of SPARS outside the households over the Thanksgiving holiday and Black Friday. So there you go, the Thanksgiving holiday and Black Friday. However, fewer infected persons remained home, thereby enabling the spread of SPARS beyond the Midwest. Second, SPARS transmissions was accelerated by infectious individuals who had not yet become symptomatic. Together, these factors led to significant spikes in the number of reported cases. By mid-December, which is where we're at right now, by mid-December, SPARS cases were reported in I can't see 26 states maybe, and right now they're saying there's 36 states, so 10 more than what they're saying in this. And the ministries of health in Mexico, Canada, Brazil, Japan, and several European countries had noted that the World Health Organization of dozens of imported cases. There was widespread concern in public health circles that travel over the Christmas and New Year's holidays would spark a global pandemic. Okay. All right. Share. You cannot share, no pun intended there, medical information. Okay, you can't do it. All right, you can't just straight up say stuff like that. I apologize, sister. And to anybody else, no medical information, nothing like that. What I did was very risky. It's my channel. I'm making that call because I care to help people. If you have medical information, why do people keep putting medical information? I'm going to start blocking people anyways, or timing people out. uh if you have medical information, go over to my Rumble or go over to my X. You're more than welcome to share it there. YouTube is very sensitive around here. Okay, very, very sensitive. And in these documents they talk about how they're going to start censoring people. All right, and so I want to be careful with this channel. Anyways, so there was widespread concern in public health circles that travel over Christmas and New Year's holidays would spark a global pandemic. That's okay, T Sage. That's all right, sister. The World Health Organization, which has declared the epidemic to be a PHEIC on November 25th, was actively engaged in preventing further spread of the disease internationally. However, the World Health Organization's efforts promoted interventions originally designed for influenza and other similar respiratory pathogens, such as hygiene, social distancing, and isolation of suspected cases, all of which were less effective against SPARS. So it didn't help. It didn't help. Okay, now hold on. I got to do something here. Oh man, you know what? It's been a brain fart day for me. I think of one thing. All right. So as I was saying, everybody, that I think it's important, in case there is something actually happening, to take things seriously. But I think there's many avenues in which these things can be happening, like I've discussed multiple times during this live. Frequencies, sprays, whatever. Okay. But something seems to be going on. All right. Something definitely seems to be going on. But is it something that we know the cause of it? I don't know the cause of it. I'm not a doctor and I'm not a scientist. Okay. All I'm trying to show everybody is that there is a coordinated effort between the news that's happening now in these wargaming scenarios that they have been working on for quite some time, and how there's also multiple scenarios running in 2025 for a lockdown pandemic, and how they've come out with this. This is a very well-known document. You can find the the what do you call it, the PDF on Google. Just type in the SPARS pandemic PDF, and you can read through it. All right, and people have their own opinions about what things are. You know what I mean? And so my point is, okay, is that I'm for myself, I'm gonna take things seriously, and I'm going to uh, do the things that I cleaned up in my office. If you can rewind it and see what I moved around, and I guess in Denmark they're saying that the new bird flu is dangerous and transmits to humans. So that, Karsten, could you share or maybe even translate what they're putting out? Because that's not being said here in America or Canada. And Karsten is Danish. Um, and like I said, I don't know what this is. I'm here to warn people. I'm here to care and to warn people and say, hey, heads up, this isn't looking that great. And we know that they have Agenda 2030 right around the corner, and they need to get to that end game, you know. Trying to see if I have anything else. I mean, there's other stuff that I could pull up, but again, just showing people earlier, they're saying this here in America, that deadly super flu surges, a surge forces schools to close and triggers mask mandates across the US. And the mask mandates are for at medical facilities. So if you work in a medical facility and oh, that's what I was going to say earlier. So, and I know he's not going to mind because he even said so. Global News Wars lives down in Grand Rapids. It's a massive city, so you're never going to find him down there. But Global News Wars lives down in Grand Rapids, Michigan. Okay. And he was telling me because his wife was just recently really sick and something ripped through his household pretty hardcore. And he said when he was at the hospital, the doctor told him that whatever's going on right now, he's never seen nothing like it before. He said this is a whole new ball game, is what you know, you know what I mean? So it's a whole new ball game. So and Karsten, I'm sorry, brother, but you keep mentioning stuff that's gonna get me hit on YouTube, brother. Like we can talk about the news and things like that, but we'd have to do a special Rumble X live to be able to bring that specific thing up, my friend. And so if you just be careful, buddy, because I got to make sure that I'm a good steward of, you know, um, this channel, because I want to be able to reach people and warn them as best as I can for those who are willing to listen. I'm gonna take things seriously myself. That's what I'm gonna do. Appreciate it, Karsten. But yeah, so whether it's real, whether it's not, whether it's this, whether it's that, I don't know. I just know that this is what they're projecting out there. I know that, they've told us in this, and this, what they're going to do. And this one was for the COVID-19 pandemic, you know? And so, I mean, it's just, we're being hammered. Again, I really feel that, there's something going on with the smell in the air. You go outside, and if you're in like any of the cold states right now, like there is this weird, weird smell out there right now, and it's almost overpowering. And I know also in California they have this chemical fog that stretches. I think it was 300 or 400 miles. They were saying, and it was literally all up and down, California or whatever. Um, yeah, so yeah, it just seems like there's a lot brewing right now. Um, Raspaz says, I live in Canada, turning crazy right now. That's all I can say. Yeah, it's pretty weird. Pretty weird to say the least. The light reflects off it really strongly too. My wife was saying the other day that it looked like glitter in the sky. And you bringing that up, Night Lab, is very interesting. Like, Mrs. End Times Talk, I don't know if you can recall, you were driving the other day and you said that everything looked like glitter. Absolutely, Mr. Galaxy Man. Absolutely. And we know that's their goal, that they want to get us to Agenda 2030. And so they're saying by the year 20, oh, that just glitched out. Did you guys see that glitch? They're saying by the year 2030 that, that this is all going to be in place. So, you know, I've been warning of this for quite some time and trying to get people, to hear me out, you know what I mean? And I just hope people are listening this time. Um as for people who resist, whatever is coming, um they have every plan and intention to make war with whoever does resist, and I'm just giving you that right now. Like, I mean, it's excuse my language. I actually got yelled at in email for cussing on my own channel, but I'm sorry. So I'm sorry for my language right now. But you're damned if you do, and you're damned if you don't in what's coming. Yeah, Karsten, you can go ahead and put up the link in the live chat if you would like, if you do it quickly. And there's riots in England. There's riots in China too right now. Let me see what I can find real quick. Let me just, I know we're in the middle of a live, but let me see what kind of digging I can do real quick. Oh, okay. All right. Goodness gracious. So this was just a couple of days ago, 4 days ago. Block all travel from China now. Hospitals in China are fighting against high rates of the influenza virus, which has been sweeping the country in recent weeks. And this is the H3N2 influenza virus have hit the country, impacting multiple hospitals across the nation. Uh, Curb it now, not in the UK. This guy is from obviously in the UK. Hold on one second. Let me see what else I can find. Hmm. Yeah. It's hit and miss, because there's not a lot of people paying attention right now. They're super busy with whatever they got going on, so not a lot of people are on board with looking into all this stuff. And I mean, I'll be honest with you. Um, I don't know what it is. Hold on one second. Got to come over to YouTube real quick to grab that link. Give me a moment. Gotta wait for the page to load. My internet's been slow too, really slow. Oh, it's a YouTube channel. I'm not going to show anybody else's YouTube channel right now. I'll have to look into it later on and figure out where their sources come from. But there's definitely a lot happening right now. Anyways, I'm not going to stay live for forever, but put in the live chat if you have been dealing with anything in your state or country sickness wise, so whoever watches this later on can kind of see what's going on. I think kind of report as okay. So make sure that you share in the live chat or the comment section below if you're watching this later on after the live, if you're seeing sickness surging in any way, shape, or form. I don't care what's causing it, okay? I just care that it's happening because they're going to use this as a means to their end game. That's what I'm worried about. That's what I'm trying to warn everybody about here. It doesn't matter how we get there. It matters that this is what they're pulling. This seems like a trigger that they're trying to pull. Everybody has their own way that they're going to go about these things. Some are going to resist, some are going to comply, some are going to mask up, some aren't. Some are going to take things that that help them feel better. Other people are going to do this kind of stupid stuff. I don't recommend this. I don't recommend that. Man, let me see if I can find this. Give me a moment here. Give me a moment. All right, I'm going to just go ahead and play this. I'm taking a real chance, but listen, and the reason I'm playing this is it's not accurate right now, but it is very indicative of what's coming. Okay, and I'm showing you this in hopes that it'll help change your mind.
Remember the swine flu scare of 1976? That was the year the U.S. government told us all that swine flu could turn out to be a killer that could spread across the nation. And Washington decided that every man, woman, and child in the nation should get a shot to prevent a nationwide outbreak, a pandemic.
I don't need another flu shot. I had a flu shot last year. A swine flu epidemic may be coming.
Swine flu? Man, I'm too fast to let it catch me.
You'll want to be protected. especially if you're elderly or chronically ill. Get a shot of protection, the swine flu shot.
Well, 46 million of us obediently took the shot. And now 4,000 Americans are claiming damages from Uncle Sam amounting to $3.5 billion because of what happened when they took that shot. By far the greatest number of the claims, 2/3 of them, are for neurological damage or even death.
This virus was the cause of a pandemic in 1918 and 1919 that resulted in over 500,000 deaths in the United States, as well as 20 million deaths around the world.
See how easy it is to...
Thus, the U.S. government's publicity machine was cranked into action to urge all America to protect itself against the swine flu menace.
Influenza is serious business. During major flu epidemics, millions of people are sick and thousands die. Well, this year you can get protection. The vaccines are safe, easy to take, and they can protect you against flu. So roll up your sleeve.
Did you guys see how they were using the same needle for everybody in line?
Protect yourself.
One of those who did roll up her sleeve was Judy Roberts. She was perfectly healthy, an active woman, when in November of 1976, she took her shot. 2 weeks later, she says, she began to feel a numbness starting up her legs.
By the following week, I was totally paralyzed.
So completely paralyzed, in fact, that they had to operate on her to enable her to breathe. And for 6 months, Judy Roberts was a quadriplegic. The diagnosis? A neurological disorder called Guillain-Barré syndrome. This disease can even kill. Indeed, there are 300 claims now pending from the families of GBS victims who died, allegedly as a result of the swine flu shot.
Judy, why did you take the flu shot?
I'd never taken any other flu shots, but I felt like this was going to be a major epidemic. And the only way to prevent a major epidemic of a really deadly variety of flu was for everybody to be immunized.
As part of informing Americans about the swine flu threat, Dr. Sensor's CDC also helped create the advertising to get the public to take the shot.
There's only one thing I can think of that hits harder than us.
What can that be?
The swine flu. It could knock you flat.
So what's the defense for it, huh?
Like our philosophy. You gotta hit it before it hits you.
You mean the shot?
Yeah.
You got yours?
You better believe it. If swine flu wants to challenge me, I'm ready.
Oh, me too, brother. Me too.
Get the swine flu shot. Time is running out.
Let me read to you from one of your own agency's memos planning the campaign to urge Americans to take the shot. The swine flu vaccine has been taken by many important persons, he wrote. Example, President Ford, Henry Kissinger, Elton John, Muhammad Ali, Mary Tyler Moore, Rudolph Nureyev, Walter Cronkite, Ralph Nader, Edward Kennedy, etc., etc. Did you talk to these people beforehand to find out if they planned to take the shot?
I did not know.
Did anybody?
I do not know.
Did you get permission to use their names in your campaign?
I do not know.
Mary, did you take a swine flu shot?
He doesn't
No,
know.
I did
Everybody
not.
all right?
Did you
Leave
give
him
them
alone.
permission to use your name saying that you had or were going to?
Absolutely not. Never did.
Did you ask your own doctor about taking the swine flu shot?
Yes, and at the time he thought it might be a good idea. But I resisted it because I was leery of having the symptoms that sometimes go with that kind of inoculation.
I'm mad with my government because they knew the facts, but they didn't release those facts because if they had released them, the people wouldn't have taken it. And they can come out tomorrow and tell me there's going to be an epidemic and they can drop off like flies next to me. I will not take another shot that my government tells me to take.
I want to rewind that for a moment because what this guy has to say is the real deal. Pay close attention to what this man says. I really want it to sink in. And everybody that's here better be ready for their next campaign. You better be ready for the next campaign.
Symptoms that sometimes go with that kind of inoculation.
I'm mad with my government because they knew the facts, but they didn't release those facts because if they had released them, the people wouldn't have taken it. And they can come out tomorrow and tell me there's going to be an epidemic and they can drop off like flies next to me. I will not take another shot that my government tells me to take.
Meantime, Judy Roberts and some 4,000 others like her are still waiting for their day in court.
Roll up your sleeve.
So roll up your sleeve. Protect yourself.
Protect yourselves. You know, the thing is, everybody, okay, is that it's clear as day what's going on. Okay, and they need mass depopulation as they enter into getting us closer to Agenda 2030, and they need their 15-minute cities, and they need their dystopian future, and they need to implement it all. And I think honestly, this is how they are going to do it. Honestly, I have always believed it's going to be medical. You want to know why I believe it's going to be medical? Is movies like Stephen King's The Stand. It is about a virus that brings about the rise of the Antichrist. Yeah, there's global conflict and all that stuff that happens in the midst of that. Excuse me, I got the hiccups. Just like that one movie, Dawn of the Planet of the Apes. Yeah, I mean, look at just little clips here, just showing.
So we, we'll have to prepare for the next one. That, I'd say is will get attention this time.
Isn't that cute? Little Billy and his wife. Now I'll tell you, Bill Gates just recently went to the White House and met with Donald Trump. And again, Peter Hotez was partnered with Anthony Fauci, was part of a mouthpiece propaganda campaign with the COVID-19 pandemic. Like I said, Peter Hotez was a huge part of that, and this is what he had to say at the beginning of this year.
Here's the reason why we need to care about this stuff, Nicole, is that we have some big picture stuff coming down the pike starting on January 21st. Mr. Bloomberg mentioned H5N1. That I'm really worried about. It's all over wild birds on the western part of the United States and going up in the north. It's getting into the poultry. We're seeing sporadic human cases, no human-to-human transmission yet, but that could happen. It's in the cattle. It's in the milk. And that's just the beginning. We have another major coronavirus likely brewing in Asia. We've had SARS in 2002, SARS-2, COVID.
I mean, I'm not going to sit here and play the whole thing, but he literally lists everything, and it's all possibilities. And he says, the Trump administration is going to have to deal with this on November 5th or whatever, or of last year, and so it just goes to show where we're headed, and man, there's one I really want to show you, but if I show it to you, I'll get hit. But it's Trump and Saturday Night Live. And he's wearing a yellow suit, and this is how you know it's the one. If you look it up, you can probably find it on X, and just type in Trump Saturday Night Live. In it, he owns like a fried chicken restaurant, which is bird, oriented. And then Maya Rudolph, Kenan Thompson, and there was a couple other ones, but the first initials of their names in the order of which they were standing around Trump spelled M-A-S-K, mask. And Trump was the guy in the middle. And it's all about the birds, and he's doing his little dance, you know what I mean? And, it's just ridiculous. Just ridiculous. They tell us and everything. Even Robert Redfield, the ex-CDC director, is saying that this stuff's coming. And Rima Labo, the same lady that was on that famous Jesse Ventura episode where she literally predicted the COVID-19 pandemic like 10 years ahead of time, came out, a year or two ago and predicted that there was going to be another one closer to 2030. And here we are on the verge of 2026 and crap's getting ready to pop off. I mean, this is where we're headed. So I'm just giving everybody a heads up. I'm going to finish it off with this last clip, some propaganda from a movie, definitely telling you what's coming. Absolutely telling you what's coming, and I hope people stay to watch this. But I love you all. May God bless you all. May he keep you. And please don't forget to go out and change the world in which you live.
If you have fever and cough or sore throat, stay home.
I'd say 95% chance this was manufactured, came out of a laboratory.
The source of the virus was traced back to drug testing done at Genesis Laboratories in San Francisco.
A lab technician, now known as Patient Zero, was accidentally exposed to retrovirus ALZ-113, an Alzheimer's trial drug that was being tested on chimpanzees.
The infected chimps showed signs of erratic and aggressive behavior that led to their escape from the facility.
The now famous incident on the Golden Gate Bridge, a 6-hour standoff with police, ended with the apes disappearing into Muir Woods.
Emergency rooms are being overwhelmed with patients showing signs of what's being dubbed the simian flu.
The CDC is projecting a fatality toll ranging from 5 million to as many as 150 million in the next 6 to 8 months.
Anyone showing signs of a contagious illness will receive special treatment here. The airport's purpose-built quarantine center.
Many of the new arrivals are children who have lost contact with their
The
parents.
mandatory quarantines have sparked civil unrest. Families are being ripped apart.
Containment is not very likely. Prepare your families, know your evacuation route.
The survival rate is now approximately 1 in 500.
Violence erupted in the city center tonight, the third incident in as many days.
Martial law has been declared in 28 nations, including the U.S. and Canada.
The reactor is overheating. We can't stop a meltdown. Our generator lost its power.
Collapse of anything resembling civilian order.
Due to the extremity of the simian flu crisis, all regular government functions have been suspended indefinitely.
Those who aren't killed by the virus will probably die in the fighting. So maybe this is it. This is how it ends. Pretty soon, there won't be anyone left.